Did. Okay. All right. So, Charlotte, thank you so much for agreeing to come onto the podcast. I'm really grateful and excited that you decided to reach out and share your story because I know it's going to help someone today.
Yeah, thank you so much, Dr. Rankins. I'm really thrilled to be here. I've actually been listening to your podcast for a few years, so
Oh,
I've had
wow.
your voice in my ears so much. I feel like I'm meeting with an old friend. So it's really
Oh,
fun to be talking to you directly like this. And
I love it.
I'm a big fan of your work.
Well, thank you. Thank you. Thank you. So, why don't you start off by telling us a bit about yourself and your family?
Sure. My name's Charlotte. I live with my husband Paul and our daughter Amaya in San Diego.
Oh, that's a pretty name.
Thank you. Thank you. Yeah, I'm from Seattle originally. I met my husband when we were both living in Washington, D.C., where he's
Oh,
from.
okay.
We were both doing an AmeriCorps program together.
Ah,
Yeah, so
but
let's
now you're
see.
you're a West Coast person.
Yeah, we've been all over. I have my master's degree in nutrition science from Bastyr University in Washington State. Um, and then after I finished my master's program, my husband and I moved to San Diego, where I was placed to do my dietetic internship at the VA hospital in San Diego.
Okay. Okay.
Um, yeah, so we thought we would just be here for a year, for this program, and
Uh-huh.
then a lot of people just end up staying in San Diego. We have the beach, we got the sunshine, so
Mm-hmm.
we ended up liking it, and now we've been here for 4 years.
Okay. All
Um,
right.
yeah, and
Nice,
I
nice, nice.
I work as a registered dietitian in a just amazing maternal and child health center. So we have kind of wraparound services there. So I'm on a team where we have, OBs, so we have people getting their prenatal care, we have
Uh-huh.
pediatricians, social services, dental care, dietitians. So I
Oh, all
really,
in the same place?
yes, yeah.
That's really cool.
It's great. It's
Yes.
the way it should be,
I was getting ready to say 100%. So, like, you can go down the hall to go see the dietitian or you know who to
Yeah.
refer to. So,
Exactly, exactly.
uh-huh.
I have, newborns who haven't had their, weight check in a while with their pediatrician, so I can just call my pediatrician friends,
Right,
so
right,
it's a
right.
wonderful, wonderful team to be on, although I am on a family leave right now to take care of my daughter, so I'll
Sure.
get into that more
Yeah,
soon. But
yeah, yeah.
um, yeah, I love my job. It's really special to be kind of in the same life stage as my patients too, as my own
Mm-hmm,
family has grown
mm-hmm.
recently. Yeah, in 2021 we had our beautiful baby daughter Amaya, and she's a year and a half old now. And
And now we're gonna get into the story
yeah,
of how Maya got here. So let's start
yeah,
off. I always like to talk about, as you know, as a listener, that in order to understand what the birth was like, we got to talk a bit about what the pregnancy was like. And yours is going to be a little bit different for sure. But let's start off with a bigger overview of what was your pregnancy and prenatal care like in general.
sure. I had this kind of unique experience from going to from a very, very low risk pregnancy to a very high risk pregnancy kind of overnight.
Mm-hmm.
So my
Mm-hmm.
pregnancy originally was just so normal, deeply desired. We were
Right.
really ready for a baby. I
Right.
had, pretty bad nausea at first, but really an
Nothing.
uncomplicated pregnancy.
Right. Right.
Originally started my prenatal care at a group practice where I had seen a nurse practitioner, and
Okay.
so I think she would have been only able to see me up until a certain point in my pregnancy, and then I would
Okay.
switch to one of her colleagues. But I just adored her. We had a good connection, so I was
Mm-hmm.
fine with that. Um, it was just a really fun time of life, finding out I was pregnant, and it was the
Yeah.
COVID era. And working in healthcare, I was taking that pretty seriously. But
Sure.
we had a lot of fun doing very elaborate announcements on Zoom for our
Aw.
families, and a lot of my best friends were getting pregnant around the same time, and
Right.
it was just a
Right.
nice, nice time of life.
Nice. Nice. So then how did things go from low risk to high risk?
Yes. I was just last night in preparation trying to like remember the timelines. So
Mm-hmm.
I had been scheduled originally for my anatomy ultrasound in my second trimester.
Okay.
But remember that I work at a maternal and child health center where we
Right.
have OBs doing ultrasounds. So,
Right. Right.
I'm kind of a shy person, but one of my coworkers asked one of the doctors if she could scan me at work just to
Okay.
kind of, just really to
Just,
see the
just
sex
for
of the
fun
baby.
and
Just
yeah.
to check in
Mm-hmm.
and see the sex. And I
Right.
was like, oh, should I wait? But remember, it was a COVID era. My husband wasn't allowed in any of these appointments with me. So
Uh-huh.
I was like, let's just find out. Let's just find
Okay.
out at work where I can have
Right.
some company. And
Right.
so we all piled into this little patient exam room.
Mm-hmm.
Some of my coworkers and myself, and the doctor scanned me, and she told me she was about 90% sure it was a girl.
Okay.
So I was thrilled. I cried some happy tears, and the
Right.
sex is really not that important to me, but just any little bit of information I could find, right, about
Sure.
this mysterious little creature inside me.
Sure. Sure.
So, the doctor was scanning me. I thought I'd be ready to go any minute, but she kept scanning me.
Mm.
Minutes were passing. My coworkers started to trickle out. They had to go back to work. And there was just silence, and the doctor was frowning and silence. And I asked, is everything okay? And
Mm.
gosh, Dr. Rinkins, I don't even remember what she said. Like, I think I blacked out, but obviously there was something wrong with my baby's heart and something pretty severe. So
Right.
I just stumbled out of that room, and like I was in an alternate universe, I just kept seeing my patients the rest of that day.
Oh my God.
My coworkers asked me if I wanted to go home, but I don't know. I don't even know how I was feeling. I just wanted to kind of put my head down and get through the rest of the
Right.
day. And
Right. So you don't even remember the exact word because it just hit you with like what's happening.
I don't remember. I'll have to reach out to that doctor and
No,
ask.
no, no. I mean, I think sometimes that's what happens.
Yeah.
You just, um, in hindsight, I remember when I was told that my daughter had an intestinal malformation on ultrasound. I don't remember what she said. Like something about it, just like it just kind of hits you. And at that
Yeah.
moment, were your coworkers still in the room, or had they all left? Or
I think a few were. Definitely one coworker was who
uh
I'm
huh,
closer to. So, and
sure,
I'm grateful. I'm so grateful that I wasn't hearing that news alone, like I
right.
would have if I had waited for my anatomy
That's true.
ultrasound,
That
right?
is true. That is
And
true. And so she
yeah,
says that, and you hear baby has a heart problem.
a heart problem. Yeah, and
Okay.
she didn't know exactly what, right?
Mm-hmm. Mm-hmm.
I do remember, it's funny what you remember, right? I do remember that day my baby had just started to move a lot,
Mm.
and I was feeling her just flip around inside me, just
Right.
full of life,
Right.
that day.
Right. Right.
So
Oh my
I think
goodness.
that experience was a little traumatic for everyone. In the hindsight, maybe don't get an ultrasound at work, but
You didn't know. I
you
mean,
didn't know.
I mean, you had no idea, and you think,
Yeah,
it's going to be a fun moment.
exactly.
I think, I've seen lots of times, like, um, like the nurses at work, and we'll hop in a room and do an ultrasound. It just it's something
Yeah.
that happens. So
Yeah.
yeah, yeah,
Yeah,
yeah. So
and
then
and
what?
it's crazy the way it all works out because my prenatal care, I was actually able to transfer immediately to that doctor who scanned me. So
Oh,
she only came to our clinic once a week, and then the rest of the time she worked at her own group practice, and she's
okay,
a maternal fetal medicine specialist. So
right,
I just had the relationship with her. I transferred my care to her immediately, and
okay,
everything, the ball kind of got rolling much more quickly than it would have, again,
gotcha,
if I had waited for that anatomy ultrasound.
gotcha. So then what happened next?
So then all the craziness started
Mm-hmm.
happening. I went from having monthly appointments to it felt like almost every day I had an appointment that first
Right,
week, and weekly
right.
appointments. I saw everyone. I got everything done. So I got fetal echocardiograms.
Uh
I had
huh.
an amniocentesis.
Uh huh.
I did have some genetic testing, which I hadn't previously,
Uh huh.
because my insurance hadn't covered it before, and now it did.
Gotcha.
I had genetic counseling. I had, biweekly fetal monitoring, and then I actually met with pediatric surgeons. So, anyways,
All with him. How long?
not all within that first week, but yeah,
Still
it was a lot. Yeah.
pretty quickly. You got all of the things.
Yeah, so I think after probably the first fetal echo, fetal echocardiogram, is when they determined that my daughter did have tetralogy of Fallot, which
Okay.
is one of the more common heart defects. It's a
Mm-hmm.
series of internal heart defects, and
Mm-hmm.
she also had pentology of Contrell, which
I
is
had never heard of that.
that's the one you got to look up, right?
Yes, I had never heard of that. So what
Yeah.
is that?
So that's a rare, very rare congenital condition that can affect multiple organs, and in the very worst case scenarios, babies are born with their organs outside of their bodies.
Oh,
Yeah, so and we were talking about this a little bit. I struggle with how much I want to share about my
sure.
daughter's conditions just because I don't know how she'll feel about having her information out there like that when she's older. So I'll just say that we didn't know if these conditions would be compatible with life after she
Right.
was born,
Right.
basically.
Right.
Uh,
Right.
in in utero, she was doing great. She was thriving,
Right.
kicking me all the
Oh,
time,
yes.
because she was getting everything she needed, and I was able to
Right.
protect her. But no one was quite sure
Right.
after what would happen after she was born.
Gotcha. So then that brings the question, what was there ever a discussion of ending the pregnancy?
Yeah, so we had a big decision to make, my husband and I,
Mm-hmm.
and I do remember quite clearly that when we officially found out about my baby's diagnoses, we had a week before we would hit the legal limit for abortion in the state of
Mm.
California. So
Mm.
we had a big decision to make and quickly.
Yes.
Um, and let me tell you, just to throw it out there, I am the most pro-choice person on the planet. I believe abortion is
Right.
health care. It's a decision a woman needs to make with her doctor, and the government should have no part in regulating it other than to make it accessible.
Absolutely.
So, just that's where I'm
Absolutely.
coming from.
Right. Right.
So, I was a little surprised at my own reaction then when I started to feel just a little angry or a little like hints of despair almost when my own providers started to mention the word termination as a very
Mm.
reasonable option.
Right.
And I had this
Right.
kind of unreasonable and protective instinct that I wanted to shield my baby even from those conversations. I didn't want her to hear me
Huh.
talking about that.
Right.
And for a very brief moment, I was grieving, I was in this
Sure.
haze almost. For a moment, I questioned if those feelings kind of contradicted my very pro-choice stance. And then it
Right.
kind of hit me. I was pro-choice, and there I was making a choice for myself and my
Yes.
family. And that choice was right for me. It may not have been
Mm-hmm.
right for someone else, and that's okay.
Right. Right.
And,
Right.
aside from my really deep intuition that I felt that she would be okay,
Mm-hmm.
there were a lot of other factors that made it possible for me to continue with the pregnancy. Like, for example, I'll just list a few, the support of
Yeah.
my family, the support of my
Right.
partner, a stable
Right.
job, and
Right.
insurance, and my health, and
Right.
no other children or caretaking responsibilities. So, all these
Mm-hmm.
things made it possible for us to, not only make that choice, but commit to raising this girl and loving her for whatever
Right.
amount of time we had with her and kind of
Right.
delving headfirst into the unknown.
Right. Right.
So,
Right.
yeah,
I mean, you just make such a beautiful point that it's about you having the choice and not someone else making the choice for you.
right.
Because if this happened today and you were in Texas, for instance, you would not have a choice.
Exactly.
And that's the part that I hope people understand, that this is not a decision that anyone takes
Right.
lightly. You don't come to, like, as you said, you've had some gut
Right.
reactions that were strong against it, but I agree very deeply that the government has no role in this, as you said, other than to support
Yeah.
access, so that people having babies can make the best choices for themselves.
Exactly. And to that point, having it be my decision and my choice was incredibly powerful and kind of fortifying for my spirit for everything that was to
Mm-hmm.
come. Being
Right.
able to say, this is the path that I choose, and not having it
Right.
be made for me or forced upon me. It really
Sure.
it really prepared us my husband was saying it kind of, and it's kind of in the darkest moments we think about that. Like, we chose this and
Mm-hmm.
we're
Mm-hmm.
grateful for everything that's happened, but it
Right.
was our
Right.
choice. Yeah.
Yeah. Yeah. Absolutely. Absolutely. So then you're about halfway through your pregnancy. You know that you're going to have a baby that needs complex care after
Right.
birth. So, what types of things did you do to prepare, or how did the medical system support you, or did they?
Right. Right. Well, um, I wish I'd done more. I wish I had done more. Well, also, I have to give my previous self a little grace because I was just trying to get through each day.
Yeah,
But before
sure.
I learned about Amaya's conditions, I had bought your birth preparation course, and I was really
Mm-hmm.
enjoying it. One of my good friends also bought it, and she was also pregnant at the same
Ah.
time, so we were kind of doing that together.
Oh, I love it.
And I hired a doula who was incredible.
Okay.
So I.
So you had hired the doula before you found
Yeah,
out
yeah,
about this.
this is
Okay.
my
Okay.
field. I was so excited to be pregnant.
Yeah.
I just
Sure.
I just wanted to
Absolutely.
do everything I
Yeah.
could and get ready to kind of
Yeah.
have a low intervention vaginal delivery, which is what I assumed
Right.
I would have. And then when we
Right.
learned about Amaya, I just kind of stopped with any birth preparation because I was finding it too painful to even contemplate.
Mm-hmm.
And then we did learn it would be a C-section.
Okay.
Because so Amaya, I'll share, was actually born without a complete sternum, so her heart was unprotected, and after she was born, we
Mm.
saw her heart beating out of her chest, um, covered by a layer of like kind of a membrane. So they,
Oh my
I know
gosh.
she's incredible. And let me just tell you, she's doing great. I don't think I've said that. She is thriving. She's on the
Right.
verge of
Right.
walking. She's talking.
Right.
Like
Right.
she's just doing
Right.
so well.
Right.
So
Yeah.
I kind of forgot
Yeah.
to mention that, but
No. No. No.
but at the time we had no idea, right? And anyways, they did want to do a C-section because with her heart exposed like that, they didn't want any pressure on her chest.
Sure.
So
Sure.
after we learned
Sure.
it was a
Sure.
C-section, I was like, okay. So I did watch the C-section parts on your course, and
Mm-hmm.
I talked to my doula about C-sections, what to expect. And about the doula, I'll just say like I had originally wanted a doula for support during labor, especially as a
Mm-hmm.
first-time mom, but she ended up being just the most incredible person to support me through all this hardship. And it was just really nice to
Mm.
have someone like very wise to debrief with after
Right.
these appointments, and also someone who wasn't
Right.
my husband or my friends or my family. And
Sure.
um,
Sure. Someone who's very neutral and
exactly. So
mm-hmm.
I'm really
Mm-hmm.
grateful to her.
Well, that's
Yeah.
amazing. That's
Yeah.
amazing. Now, when you met, you said you met with the pediatric. Did you meet with pediatric cardiologist and pediatric surgeons?
Yes. Yeah,
Mm-hmm.
so actually, so we let me see. We started meeting with a cardiologist when I was pregnant who was doing the fetal echocardiograms, and she is
Okay.
still Amaya's cardiologist. So yeah,
Aw.
yeah, so she's seen us through all of this, and I ended up meeting
Right.
with a pediatric surgeon and also a pediatric cardiothoracic surgeon who would both end up operating on her. Um,
Okay.
I took a tour of the NICU, which I don't know. That was a pretty horrific experience. Just I don't. I think maybe I shouldn't have done that.
It's the NICU. I mean, it's yeah. I think we're both having a moment of like having had a child in the
Hmm.
NICU and seeing the other children. It's uh yeah, I don't know.
Yeah.
I'm having a hard time putting into
Right.
words. Like
Yeah. 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 It was just like checking off things to do, right? Like, oh, I should see
mhm.
this. I should see this.
Mhm. Mhm.
I saw the hospital where I would deliver, and it's right next to the children's hospital. So
Okay.
I
Okay. I was going to say because this is going to require some specialized. You don't find pediatric cardiothoracic surgeons everywhere. So,
I know.
I mean, did you have to travel any distance, or did you happen to be in an area that had those specialties
We just
available?
happen to live in this area where we're 25
Okay.
minutes from this world-renowned children's hospital, and
Mm-hmm.
it all seemed to work out, like even
Right.
us moving to San Diego and just we happen
Yeah.
to be right here. And but that is a factor,
Mm-hmm.
and when we're thinking about if we ever might move in the future, we're not going to be able to move to some small town. We'll have to be
Right.
living fairly close to a large hospital for the rest
Right.
of our life, which
Right.
is totally fine. But
Sure.
um,
Sure. Sure. Sure.
yeah.
So, was there ever any attention paid to your mental health during this?
Yeah, yeah. I did find a therapist who I actually, again, it was COVID. I did virtual visits with her. Not even that frequently, maybe once every few weeks, but
Okay.
that felt important again to have kind of a neutral third party. And um, I remember you saying when your baby was in the NICU that you gave yourself like a time to cry every day. And that really resonated with me, and that's what I did. Like every day I went to the shower and I knew like, okay, I'm going to cry, and then I'm going to
Right.
come out of the shower, and the shower is the best place to cry, by the way, because you can just
Right.
clean up.
Just kind of right. Right.
But
Right.
yeah, that
Right.
kind of allowed me to just keep, living my life and showing up for the next appointment and showing up to work. I mean, I kept working through
Yeah.
this time too. And yeah, I think people were quite concerned, but the attention was all on the baby, as prenatal care is kind of focused, it's on the baby. So I'm really lucky to have kind of, amazing family, amazing friends, really wonderful built-in network that I relied on. But it was a horrible time of life. I was grieving. I was crying every day. I had no idea what to expect, and it was hard. I do remember I really debated on if I should get pregnancy pictures done, which is something I had wanted to
Oh
do,
wow.
but I was like,
Right.
gosh, I feel like
Right.
I'm in this grieving period. But I ended up doing those pictures, and thank
Uh huh.
goodness I did, because I treasure those pictures, and I think, even if things hadn't gone the way they did, even if we had lost my baby like we were fearing, I think I still would have treasured those pictures. So,
Yeah.
yeah.
Yeah. That's great that ended up coming to that. Actually, data kind of shows that most people, even when they know that they're going to lose a baby or if a baby passes away, that they actually do appreciate having those photos. They can help in the healing process. Some
Absolutely.
people think it's like, oh, strange. Why would you want photos of your baby after they pass away? But it can actually be really helpful.
Absolutely. Yeah.
Yeah,
Yeah. And I
yeah,
treasure those. I was
yeah.
just looking at them with my daughter the other day. I was like, there you are in mommy's tummy. And she was like, like, not too sure about that, but
Like, I don't know about
I don't
that. Okay, if you say
know. It
so,
was pretty
mommy.
weird.
Oh, goodness. All right. So you knew that you were going to have a cesarean. You said that you also did a birth
Yep.
plan. So what were some of the things that you put in your birth plan for your cesarean?
Yeah, so we did make a birth plan that our doula helped us write, and that was such an amazing kind of service she provided. I didn't even know where to start. I know there's lots of resources, and you have resources, but I, again, just wasn't in the headspace to,
And it's different. It's going to be
right,
different than yeah,
right.
yeah,
So we
yeah.
included things like, you know, it, if it's safe and the baby doesn't need immediate support, please let me hold her for as long as possible before she's taken to the NICU.
Sure.
Or we had things like, because we were worried about her survival, please help us with any memory making when she's stable, like making footprints or letting us give her a sponge bath. And then
Right.
for me,
Right.
I requested, immediate support, like lactation support, even though I am actually, I do breastfeeding support at work. I'm a breastfeeding educator, but you
Right.
still need the
Yeah,
support. It
it's
doesn't
different.
matter.
Yeah.
And I was
Yes.
so grateful to the lactation consultants who helped me in the hospital.
Right.
So it also this is kind of a funny thing. I had requested on my birth plan for only kind of essential talk to take place during my C-section, and
Uh-huh.
that's something my doula had
Right.
suggested, which is something I never would have thought of, but it sounded
Right.
reasonable to only have kind of, the necessary chit chat. And
Sure.
Dr. Rankins, when these doctors were sewing me up after my C-section, after the baby had been taken to the NICU,
Right.
they just started talking to each other about their weekend plans.
Oh my
But
God.
you know what? I was so grateful to have that background noise because it let me know that I was okay. If they had just been
Ah.
sewing silently and I didn't have my
Uh-huh.
baby there, I didn't have my husband there because
Right.
he went to the
Right.
NICU. I think if it had
Right.
been silence, I would have been pretty freaked out. So it was oddly
Gotcha.
comforting. So
Gotcha.
thank goodness they didn't read that part of my birth plan.
Oh, that is funny.
Yeah,
That
and
is
I
funny.
probably various things on my birth plan didn't really go. I don't know how much they read it. There was a lot going on that day, as you can imagine, but
Yeah.
it was
Yeah.
really important
Yeah.
for me to write and for my husband and I to kind of have that internal clarity about our wishes,
Mm-hmm. Mm-hmm. Mm-hmm.
even if it didn't happen 100%. So I highly
Yeah.
recommend that
Yeah.
for everyone.
So I guess it so did the two of you take it upon yourselves to kind of think through different scenarios and what you might want to do or not do and how things transpired? Is that fair to
Yeah,
say?
absolutely. I mean, we wanted quality of life for our baby, right? So
Mm-hmm.
if they had told us, she would just have a incredibly poor quality of life, then we probably would have made a different decision. It's funny because the doctor who did my amniocentesis, I was talking to her about that. I made that exact point, and this like haunts me because she told me, well, you have to think about what quality of life it would be for a baby to be in the hospital for months at a time. And I was like, oh gosh, you're right. And you know what? Our baby has been in the hospital for months at a time. And actually, most recently, she had a surgery 2 months ago, and her second open heart
Right.
surgery. And we were in the
Right.
hospital for 40 days and 40 nights, because she
Mm.
did have some post-op complications. And so
Right. Right.
it's hard, it hasn't, there have been times of her life that have been really challenging. She's been through so
Mm-hmm.
much already in her little life.
Mm-hmm.
So,
Mm-hmm.
but, here she is, like she's in the next room, she's playing with my husband,
Right.
she's
Right.
eating,
Right.
she's going to the park. So I think,
Right.
I think it's all been worth it. I know it's all been worth
Yeah.
it. So,
Sure. Absolutely.
yeah.
Absolutely. So was your C-section itself pretty straightforward?
Yeah, yeah, it was pretty straightforward. I mean, other than I would just couldn't stop sobbing, which I I wish that I had kind of been able to be a little more stoic, but I had just kind of lost it by that point, and I was crying, and
Yeah, you felt how you felt
yeah,
in the moment.
yeah,
It's so I everybody, every birth experience, I hope we all give ourselves some grace to, you just feel what you feel in the
yeah,
moment and you go with
yeah,
it. I mean, that was a lot that you had to manage, and everything was kind of like this was the big moment where you were going to find
right,
out, what your baby looked
right.
like. So I can totally
Yeah,
see
but
that. Yeah.
everyone was really kind.
Mm.
Really empathetic. We met the NICU resuscitation team, so
Uh-huh.
they were the two people who were going to be in charge that baby made it from the women's hospital to the NICU at the hospital next door. And they were
Right.
just the most kind women I think I have ever met. I've only seen them that one time. I
Mm.
wish I could even remember their
Yeah.
names because they were just like
Right.
angels.
Right. Right.
Yeah, the doctor who did my C-section, I had met him once previously. I had
Okay.
requested to meet him, and he kind of popped out into one of my other appointments, and I just said hi, and he was
Right.
nice. It's kind of he was nice, and he was talented, and
Right.
yeah, I
Right.
didn't have like much of a relationship with him, but it's okay.
Sure.
It all seemed to
Sure.
happen pretty quickly, and um,
Gotcha.
I was
Gotcha. And were you full term?
I was 38 weeks. At the
Okay.
very end of my pregnancy, they did diagnose IUGR, intrauterine growth restriction. So
Okay. Okay.
she was born small. She was born at 5 pounds. But up until the very end, she had been growing pretty well. So, anyways,
Sure.
that's why they
Okay.
wanted to deliver at
Do it a little bit
38
earlier.
weeks, and
Yeah.
yeah, I was surprised. I know everyone says that you can still feel things when you're getting your
Mm-hmm.
C-section done, and I was
Mm-hmm.
surprised how much I could feel. Not pain, right? But it just
Mm-hmm.
felt like someone's like shaking you, or
It is a very
it's
odd
weird.
sensation
It's very
because
strange.
things are happening to your body, but you have no. It's like what's going on? Like something's
Yeah,
happening.
yeah,
Yeah.
yeah. I didn't want to see, I know that's an option for like gentle C-sections to kind of, but
Mm-hmm.
I just didn't want to see.
Yeah.
Um, and yeah, after the C-section, they took the baby away immediately and kind of checked her out, and my husband was with her, but they did bring her back to me briefly, so she got to lay on my chest for, I don't know, 5 or 10 seconds. And
Okay.
I was like, I wish I had been able to kind of enjoy that moment more, but
Right.
I was kind of like, you guys need to get her out of here. Like, you guys need to go make sure she's okay and take her to
Right.
the NICU.
Right.
And
Right. Right. Right.
yeah, we have a few photos that my husband snapped where they're just the most horrific photos. I'm just like crying and bright red, and but
Oh.
I did get to see her
Okay.
before she was taken away. Yeah.
Gotcha. Gotcha. And what was your physical recovery like from your
Yeah, I mean,
C-section?
C-sections are no joke, as we know, as you know.
Mm-hmm.
The first day I felt fine, and I was just so happy that first day that my baby had survived, you know, because
Right.
my worst fear, oh, sorry,
No.
yeah, my worst fear is that she wouldn't have made it, you know.
Yeah. Yeah.
So I was just so happy that she had survived her birth, and that
Right.
she was safe in the NICU and she was stable,
Yes.
you know, and my husband was over there
Yes.
sending me pictures and sending me videos. So
Right. 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 Right.
yeah, so
Right.
I felt happy that first day, and my mom was with me, and I think I was a little loopy from all the drugs. And I felt fine. I started pumping immediately.
Mhm.
Um, and
Did you have any challenges with pumping?
yeah, I think I always had a little bit of an undersupply, and um, I think the stress really affected me. So that first day I felt good, right? But the second day,
Right.
then the pain starts to really hit you.
Mm-hmm.
I had a really bad reaction to the opioids. I just did not
Oh.
like the way they made me feel at all.
Uh-huh.
So I
Right.
opted for, like, what is it, Tylenol and ibuprofen kind of alternating.
Uh-huh.
So I just did
Right.
that, and I was in a lot of pain, and I think that pain um, affected my milk supply, and not
Mm-hmm.
being next to my baby, and I was
Mm-hmm.
just
Mm-hmm.
tired. So I know you're supposed to wake up every 2 or 3 hours and pump, but I just wanted to rest a little bit. And
Yeah.
you know, it's not like you're breastfeeding a cuddly baby. It's like, okay, here goes
Yeah.
my alarm, and I have to
You gotta slap those
slap
things
those
on.
things
Yeah.
on. Yeah.
Yes. Yeah.
But all that said, I actually I am still pumping a year and a half later.
Okay. Look
I know.
at
And my baby
you.
breastfed for a while. But then
Mm-hmm.
after her first surgery when she was 2.5 months old, she lost all feeding skills and was fed with exclusively by a feeding tube for a while. And
Okay.
then we had to just focus on kind of her bottle skills. I had to fortify
Right.
my breast milk anyways because she needed more calorie dense. She needed small
Yeah.
volumes and high
Yeah.
calories. So I ended up going
Uh-huh.
the route of exclusively pumping, which I never would have imagined for myself. But
Right. Right.
you know, it is what it is.
You
And
go with the
yep,
flow and
yep. And
yep.
I'm,
Yeah.
you know, I'm pumping a little bit here and there. I give it to her like a daily little vitamin shot, it feels like. And
Gotcha.
I'm
Gotcha.
ready to stop,
Gotcha.
I think. I don't know. I don't know why I can't quite let go of it. It's just in my routine now. Um,
Yeah, I mean, plenty of people pump two
yep,
years, 3 years,
yep,
even some. So
yep.
you'll stop when you're ready to
Yeah,
stop.
exactly. Yeah.
And how long was she? You said she's been in the hospital a couple of times, but how was it in that initial period of like when you leave the hospital and you leave without your baby?
Yeah. It was horrible, you know. Although because we were expecting maybe even the worst case scenario, it
Mm-hmm.
also felt
Mm-hmm.
good. You know, it felt like,
Mm.
"Ugh, our baby's here, our baby's safe."
Right.
So,
Right.
that second day, you know, I said the first day I was feeling good. The second day I started to feel a lot more pain, but the second day I was able to go
Mm-hmm.
visit my baby for the first and kind of meet her for
Okay.
the first time. And so
Right.
those two hospitals, the women's hospital and the children's hospital, are right next door. They're
Uh-huh.
only a 10-minute walk if you're walking briskly, but if
Okay.
you're in a wheelchair recovering from a
Uh-huh.
C-section, it took a long time. It took maybe a half an hour to get over there because my husband had to push me just so gently, and I just felt
Right.
every little bump in the road in that
Oh
wheelchair.
goodness. Right.
And
Right.
So I was able to start visiting her that second day, but I had to get back to my hospital every 3 hours for my pain medicine, which I really needed. They wouldn't
Oh,
give it to me to take on the road, so I had really brief visits with her. I could be over there for maybe an hour and a
got
half
it.
before I had to go back, and the journey
Right,
over there
right.
was really painful physically. So
Yeah,
that was really hard. I was feeling really depressed then because I was like I was weighing the pain of my C-section versus
yeah.
spending an extra hour in the hospital with my
That
baby.
what
And
that I have never thought about
yeah,
that.
I wish
Wow.
maybe I had pressed them more. Like, look, just give me some Tylenol for
Yeah.
the road, or maybe I just should have taken it.
Yeah. I
But
mean, it's
it's
Tylenol. Like
Tylenol, yeah,
I can go get yeah.
yeah. I
Yeah.
don't know why. And I was just worried. I was like, oh, I better get back so they can check me. And
Sure, sure,
so,
sure. I mean, well, you shouldn't have to press it. I mean, really, we should by default think we should be thinking through these things. I don't think these are things that we think through with like in a logical kind of way. Sometimes we're just
yeah,
so like, you have to get the medicine and this and that,
yeah.
and we need to be a bit more flexible
I
about
definitely
things.
agree with that. I definitely agree with that. But I think now I would definitely know how to advocate for myself a little bit more. At that time, I really didn't. I was just kind of getting by, you know. Um, but that was hard. So I forget how long I stayed in the hospital, maybe 4 days. And
Uh
those
huh.
were horrible 4 days because each day I would go over painfully, try to see my baby, try to breastfeed a little bit,
Right.
and then just have to go back. And then my husband would stay with
Right.
my baby, so I was feeling really lonely. I mean, I had some
Uh.
family members come to visit, which was really nice, but
Sure.
yeah, those days really sucked. So your question about leaving the hospital, I was actually so relieved to get out of there and go to my
Mm-hmm.
own bed and be at home.
Mm-hmm.
And
Mm-hmm.
then we could drive to the hospital and just, I would load up on all my pain medication and
Yep.
snacks and everything,
Yep.
and I would just stay there with
Yep.
her. So it was actually kind of a relief to leave the hospital. And
Okay.
yeah.
Okay. Okay. And what was it like with the NICU staff and the nurses and things like that?
Yeah. The NICU staff are amazing, as you know.
I mean, they just
They're
are.
amazing.
They are just some of the most like amazing
They're
people. Yeah.
angels.
Yes. NICU
I think it's a
nurses are
calling,
just.
really.
I mean, it really and no shade to neonatologist physicians. I mean, I don't know how it was with you. Like, I would see them for a hot second, but it was those NICU nurses who would like really be with
Yeah.
you and like, hey, come do this with your
Yeah.
baby, or hey, come. So I don't know what your experience was like.
They taught us how to be parents, it felt like, like they taught me how to give my baby a bath for the first time. And I
Yes,
remember my
yes,
husband and I were being so gentle, like just barely wanting to touch her with the sponge. And the nurse was like, no, like get in there,
get
you
it.
got to clean
Yes.
your baby. And, yeah, all that said, I will say they are human, these nurses,
Uh
because
huh.
sometimes
Uh huh.
we really think they're like superhumans, which they are, but they have multiple patients and they have
Yeah, they
long
do.
hours. So I
Right.
will say,
Right.
there also is some human error that, and you do kind
Mm.
of have to watch out for that, and you have to be the
Right.
advocate for your baby. And but
Right.
it's
Right.
especially in
Right.
those first few weeks, they were just incredible. They were so supportive of me breastfeeding, and just I got free meals there because I was breastfeeding. So I just felt
Mm.
like really taken care of by the staff there. Yeah.
Awesome.
Yeah.
Awesome. Awesome. So, is there anything as we wrap up that you would say about this postpartum period or since she's been born? I feel like the postpartum actually lasts forever. Like after you have a child, you're forever changed. But in the
100%.
first, yes, in these first 18 months of her, you said 18 months, right?
Yeah,
Of her life.
I
Like,
forget the months, but yeah, around that.
okay. So, what, is there anything in particular that stands out for you?
Yeah, gosh, so many things. I mentioned briefly that she just had her second open heart surgery a few months
Mm-hmm.
ago, and that is not an experience I would have wished on my worst enemy because it's
Mm.
so much harder now to have a toddler in the hospital. when she was a tiny baby,
Hmm.
she didn't care who was holding her. I mean, she preferred mom probably, but
Yeah.
anyone could hold her.
Yeah. Yeah.
Now that she's a year and
Yeah.
a half, she
Yeah.
wants mom
Yeah.
and dad, and she doesn't want anything to
Yeah.
do with anyone else. So that
Yeah.
it's been traumatic, quite frankly, for our whole family,
Mm.
it's been, and for her. And I think we're going to be helping her to recover from all this medical trauma for a long time.
Mm.
Um, and I just I guess my purpose or my goal of going on this podcast was maybe to help any other moms who might be in other situations or similar situations, or anyone going through a high
Sure.
risk pregnancy. So I
Right.
just, if it's okay, I'll speak right to those high risk pregnancy moms. Like,
Please.
I just want
Please.
to tell you that you're not alone. Congenital heart disease affects 1 in 100 births, and that's just one of many reasons a pregnancy could be high risk. So you're not alone. I would say, if you have the capacity, try to find people who have been through something similar, even if it's an online community, because no one else is going to understand unless they've been through something similar. So
Hmm.
that said, you need to also let your friends and family be there for you, even if they don't fully understand. And try to find some moments of joy in your pregnancy. Don't feel guilty if you're feeling happy one day. Just let that feeling wash over you. Um, and
Yeah.
then finally, you will transform into a stronger version of yourself through this experience, because I
Mm.
certainly have. So even if it feels like you're breaking, you're just getting stronger. It's been the fight of my life advocating for my daughter through my pregnancy and her
Hmm.
surgeries, and especially this most recent one, and kind of shepherding her through all her therapies and all these appointments, and things we'll have to deal with that other families don't for the rest of her life. But that experience of kind of opening my heart enough just to fill her up with enough love to get her through all of
Right.
this. It's been a great
Right.
fight,
Right.
and the thing about great fights is that they're transformational, and I am transformed,
Mm.
into a stronger woman, and to by being her mom and by being her advocate, and I'm stronger for it, and I'm proud of myself and proud of my family, and whatever happens in your high risk pregnancy or with your baby, you will be stronger for it.
Mm. I love that. Thank you so much. That just touched my heart for sure. And you have touched the heart of someone out there listening
Thank you
as
so
well.
much.
So yeah. So where can women connect with you? You can say nowhere if the answer is nowhere.
Yeah, I'm not a big social media person, so I would say
Okay,
my
there we go.
email.
You know, I don't want you to say it because people, it'll get scraped by like, you'll start
Okay,
getting spam because they'll pick up. Yeah. So if anyone wants to contact you, they can message me and we can put you in
absolutely.
contact
And then
with
we
Charlotte
actually
if you're
have kept a
interested.
blog, where we write about our experiences with the baby.
Oh,
I would
yeah.
say if you want access to that, you can write me and tell me a little bit about yourself, and then I'll give you the link. So, yeah.
Okay. Okay. Awesome. Awesome. Well, Charlotte, thank you so much for agreeing to come onto the podcast. I really, really appreciate you sharing your
Thank you
story.
so much. It was a privilege, and thank you again for all of your work.